Welcome back. If you or someone you know has had chemotherapy, you know all too well the lasting and sometimes debilitating side effects. Well, now there's hope for chemotherapy patients with nerve damage. Dr. Bowtie, DC of Swisher Chiropractic is here this morning to tell us about his non-surgical, non-invasive, drug-free therapy, and he brought along his patient, Dennis McClurg, and Dennis's wife, Joyce. Welcome to all three of you. Thanks so much for being here.
Thank you.
Doctor, I want to start with you. Big congratulations. You were just named the best chiropractor in Denton County.
Thank you. Thank you.
That's awesome. All right, so you specialize in peripheral neuropathy or nerve damage caused by chemotherapy. What are some of the symptoms with people who have this? What do they experience?
Sure. Well, first of all, thank you for having us on here. It's an absolute pleasure to be on Good Morning Texas. Peripheral neuropathy typically affects about 24 million Americans out there. Typically starts from diabetes, chemotherapy, trauma, and or other illnesses. The symptoms people will have are numbness and tingling, muscle weakness, a burning sensation, the inability to walk, and then the loss of balance.
Yeah, a lot of things that would be very difficult for anyone. And I know, as we've mentioned before, you developed this non-surgical, non-invasive, drug-free program to reverse that nerve damage. So what exactly does it involve? Sure.
So my program it's based on scientific principles. It uses a wide array of technologies. We use high-powered lasers, also neurolight therapies developed by NASA. In addition, we use vibration stimulation and deep muscle therapy to basically reestablish the nerve flow throughout the body. And the result is our patients get well.
And I understand the program can actually reverse nerve damage. How does it do that?
So, like all neuropathy cases, no matter what the cause is, there is a common denominator. One is deterioration of the peripheral nerves or blood vessels. So the analogy I typically give my patients is that imagine a plant where the roots of the plant are going to be the blood vessels, the stems and the leaves are going to be the nerve and the nerve endings. So we've all done this, but what happens when you stop watering a plant?
Right.
It dies.
Exactly.
Yeah. So like chemotherapy, it can be successful in destroying the cancer, but it also destroys the peripheral blood vessels and then the peripheral nerve. So my program creates an environment where we increase blood flow, we heal the tissue, and then the nerve comes back.
Dennis, you were suffering from this type of nerve damage. What were some of your symptoms?
Well, originally it felt like I was standing on coil springs about this high, and lack of balance and the numbness, and I just couldn't feel the brake or gas pedal to even drive, so I just haven't driven.
How did you hear about the doctor's program?
Well, at church, this very nice couple of ours we go to church with, the Besselmans, they referred us to him, and wow, with him and his dedicated staff and his therapy, I'm walking without a cane.
And you're driving, I understand, too.
Well, I'm starting to.
Starting to drive. That's a huge accomplishment. And Joyce, you know, watching your husband, your significant other, go through those types of symptoms and now seeing him today, have you seen a drastic change in your husband?
Well, I have. When he went through the chemo and radiation, I thought that was bad, but the peripheral neuropathy, I think, just topped the list. But yes, he's got his life back. We have our life back.
I'm so happy to hear that, and I know that's got to make you happy. How many treatments does it take?
So that's a real hard question to answer because there's so many different causes of neuropathy, but I will tell you this. The sooner you get in, the faster we can get you well.
All right, let's talk about a special offer you have for our GMT viewers. It's a great offer.
Absolutely. Well, in appreciation for Good Morning Texas allowing us to be here, if you're out there and you're watching and you have peripheral neuropathy, or know someone that does, especially from chemotherapy, I want to help you. Now, there are fantastic doctors out there and oncologists that are saving lives every day, such as Dr. Costa, Dennis's oncologist. But just because you're alive, it doesn't mean that you're living. So I want to help get your quality of life back.
Okay.
So for the first 25 callers that calls our office and schedules an appointment, we're going to do a free, no obligation consultation so I can see if I can help you. Second of all, I'm going to give you a copy of my book, The Modern Guide to Neuropathy, as well. So the one thing I can't guarantee that I can help you, but the one thing I can guarantee is that I'll be honest with you.
All right.
So if I can help you, I can. I'll tell you I can. If I can't, I'll tell you I can't.
We appreciate your honesty and the great offer. Thanks so much, and our thanks to the McClurgs this morning. And you can find out so much more about Dr. Ty's program by calling the number on your screen, 940-202-1198, or go online at howtobeatneuropathy.com. We'll be right back.